I'm working a day shift at the hospital. I work at a large hospital in Minnesota, and I am on the Surg Oncology floor here, which for everyone who does not know what that means, we see a variety of pretty much any type of medical and or surgical patients, but we mainly specialize in oncology, so in cancer and tumors. Most people who are admitted to the hospital that have any type of cancer do come to our floor, but like I said, we also can get really any type of patients if we have the room, but we prioritize oncology patients. For this video, I want to explain exactly what I do on my typical day shift at the hospital as a registered nurse. I love watching day in the life videos. I think they're so fun and they can be really informative. However, when I was looking for these videos, I really wanted to see and hear exactly what happens during a shift for a nurse, and I hardly ever could find that exactly. Instead, day in the life seemed to really focus around like what they do before and after a shift rather than what is going on during that shift. And as a new nurse, I really wanted to see what was going on at different hospitals, how different nurses organize their days, what was expected of them on a shift. So those are more so the things I'm going to focus on during this video. As we all know, there are many privacy rules, so as much as I'd love to just bring you along for a shift and explain as I go, I cannot. So instead, I will talk through what a day shift at my hospital looks like. I start out by arriving to work around 6:45 a.m. It takes me some time to park, walk into the hospital to my floor, put my lunch in the fridge, all that good stuff. I clock in right around 7 a.m. and head over to the main desk on our unit for morning huddle. This typically includes both of our floor's nurse managers and the charge nurse that was on overnight, and they give the oncoming nurses a quick rundown of any important news or updates. They give us our patient assignments, and then I head back to whatever pod I will be working in. I choose a computer and desk area to use for the day, log into the computer and into our electronic health record system. We use Epic. I print off the handoff report for each of my patients, which, by the way, we typically get 4 patients per nurse on our floor at our hospital. That number can definitely fluctuate. Next step is to start researching each of my patients and taking handwritten notes on that handoff report that I had printed off a little bit ago. I usually do this until around 7:15 in the morning, which is the time we're expected to start nurse-to-nurse report. I then find the nurse or nurses who had my patients overnight, and we spend on average, I'd say like 15 to 20 minutes to do a report on all the patients. And throughout that time, I'm writing down more notes on those handoff sheets that I mentioned before, just making a little, almost like a to-do list, I would say, for all the things I have to get done on that shift for the patient. Once report is done, I usually take a bit more time to do some more chart research on my patients to answer any questions that came up during report. I also take time to look at the Nurse Central, also known as the brain, which shows a schedule for all 4 of my patients combined, and it has like specific things, time-specific things, like what meds are due at what time, do they have a scheduled procedure at a certain time, do they need blood sugar checks, do they have any labs due or specimen collection samples that need to be collected. It shows all of that stuff in one spot, which is really handy. I should note it does not show everything that needs to be done in this shift, so you still need to look at each patient's individual Cardex to see what else is required on the shift, but it gives a good overview on things that need to get done at a certain time. So it's good to look first at that so you don't miss anything that might already be due soon. And then there's typically 8 a.m. meds on our floor for just about every single patient. It's probably the biggest med pass of the day, I would say, typically. So the goal is to get all meds done within an hour of their scheduled due time. So it's good to start thinking about that early on in the morning so you're like not missing something and starting off your day really late. Typically, by the time 7:45 a.m. rolls around, I've had the time to learn the most important things about my patients, like their code status, a brief history of their hospital stay, why they're here, any relevant past medical history, how they ambulate, what their diet is, and what their baseline neuro status is. At that point, I feel comfortable going into their rooms with their first round of meds, so I choose whichever patient I think needs to be seen first, which definitely varies greatly each shift. But then after I decide that, I head on in. So I introduce myself, grab their vital signs if the aide hasn't already. Most aides help you with vital signs, but they don't always have time to get around to every patient. So sometimes you gotta check, make sure, get the vital signs. And at least, even if the aide gets the vital signs, you always wanna look at them, what they've been charted as, because you want to make sure nothing's off. After I get vital signs or check on vital signs, I also do a quick assessment of what's relevant for that patient, because I usually save a more thorough assessment for later in the morning after it's slowed down a bit. I give them their meds that are due, then I make sure all their basic needs are met, like do they need help ordering breakfast? Some patients need help actually being fed because they can't feed themselves. Do they need to use the bathroom? Do they have water? Are they too hot or too cold in their room? Do they need to be repositioned, etc.? After that first assessment, I frequently have to run back to the med room to grab some PRN meds, aka as needed meds, because oftentimes patients will wake up with pain or nausea, or they want a med that isn't scheduled, so that can add extra time. Just note that. There's also many patients that have a G-tube, say, and all their meds have to be crushed and administered through the G-tube. That can take a while. Or there are IV meds that I need to prime new tubing for. Or there's patients that can only take their meds one at a time, very slowly, and they have like 30 meds due. So even something as simple seeming as passing meds can end up taking a long time. I'm always aware of this because sometimes I might want to save those slower rooms for last so I don't end up giving all my other patients their meds late. Just something to think about. Once I get this initial 8 a.m. med pass and basic assessment done for all my patients, it's usually between 9 and 10 a.m. All throughout the morning too, I am getting a lot of people calling for different things like help with toileting or help getting up to the chair to eat their breakfast, all that good stuff. And those are things that the aide can definitely help with and should help with if they have time. But sometimes they are so busy in the mornings that you end up having to do a lot yourself. So around 9 or 10 a.m., I've seen all of my patients, completed initial assessments, hopefully gotten any of their morning basic needs taken care of. This is when I try to sit back down, regroup on what else needs to be completed for the rest of the shift. A lot of patients have things like daily wound cares, bolus tube feedings. Sometimes the catheter needs to be placed or removed. Every once in a while, they put in an order to place an NG tube, although that's a little more rare on our floor. A lot of patients on our floor, however, do need blood product transfusions, so red blood cells, platelets, cryo, that kind of stuff. So I make a plan in my head about when I want to go get these things done, and I usually try to stack any of those cares with a med pass for the patient if there are any meds due, just so I'm not constantly in and out, because not everybody wants people in and out of their room all the time. During this planning time, I also need to assess hygiene needs and ambulation needs for all my patients. So who needs help getting a bed bath that day? Who should be trying to ambulate that day? Those are things that I can coordinate with the aide on getting done, and oftentimes even our awesome physical therapy team, thanks physical therapy, comes by and can help with that. So once I've got my plan down for the rest of the shift, I try to check a few of those required tasks off of my list. And it is important to remember that some wound cares and other tasks can take like an hour to complete. And some of these super long tasks, you need to ask for help because sometimes there's just not enough time in the day. So ask your charge nurse. Our hospital has a circulating nurse that's sometimes free to help. Otherwise, if there's no one that can help on a crazy busy day, which happens, do not forget that nursing is a 24/7 job. So if you literally could not get something done on your shift, you just need to be honest with the next shift, let them know it was a really busy day, and then nicely ask them if they can go get it on their shift or get it done on their shift, you know? It's okay to ask for help. And it's okay to sometimes leave things for the next shift if there's just too much on your shift. It's impossible. We're human. We can't always get everything done. Anywho, after getting a couple of required tasks done and taking care of any meds that have been due throughout the morning, I typically try to sit down for a little bit around 12 p.m. or so and start charting. This is a late start for some people with charting, but on day shift, I just find they're so busy usually that honestly, like around 12 p.m. is the first time I can get started on charting. So this is also lunchtime for most patients, obviously. So they'll be calling to get up to their chairs for lunch or for help ordering if they need help feeding if they need help with that. But this is a time when I really try to ask the aide for help because I do need to sit down and chart. And I don't want to save all my charting for the end of the shift because there's a lot in charting that can help guide your thinking for the rest of your shift. It will make you think about, has this patient peed today? If they haven't peed, there's a concern usually. And you need to start thinking about their hydration. getting them to the bathroom and trying to go, bladder scanning them if needed, just to make sure there's not retention, all of that good stuff. So charting also takes you through screenings, like fall screenings, pressure injury screenings, nutrition screenings, other like risk screenings. So it helps you think about a lot of important things for your patients. And you want to be able to chart that you were able to complete some type of intervention to help your patients, because that's what a good nurse does. We're here to help people, not just pass meds. After I've charted for a bit, I go check back in with my patients to see if they need anything, bring any more meds that are due. Then I typically try to take my break. Every day is different, but usually for day shift, I end up taking my break around 12:30 or 1 p.m. We get a 30-minute break at our job. But I'd like to note I definitely do not always take a break. And I know a lot of nurses that also do not take breaks sometimes. Some shifts are just so busy. Sometimes I feel like I couldn't even enjoy sitting down to eat for half an hour because I know there's just still so much to get done. It just makes the break kind of stressful. Other times you might have something kind of crazy happen, like a patient isn't doing well, so you don't even feel safe leaving them for half an hour. There's a lot of reasons why people don't always take breaks. So sometimes I just work without a break, and I do not encourage that. I encourage everybody to take their breaks to prevent burnout, and because mentally you deserve a break and you need to eat to be able to focus and work hard. So take breaks if you can. If you can't, make sure you're getting paid for your missed break, and at least take a minute to grab a snack to eat at your desk or whatever, because you have to take care of yourself. Anyway, assuming I did get a break, I come back 30 minutes later feeling so refreshed. Just kidding. 30 minutes is basically enough time to warm up my food, eat, go to the bathroom, and then get back out there. Not really a long enough break, in my opinion, to actually feel refreshed. But I get back on the floor around 1:30 p.m.-ish, check in with my patients to make sure everyone's still doing all right, complete any other remaining med passes, any other remaining tasks that I've got to get done, and then I'll hopefully be done with all my rounds and tasks around 2:30 p.m. At that 2:30 p.m.-ish time mark, I can finish up my charting and writing my notes. At my hospital, we're required to chart on each patient and to write a shift report note on each patient. All in all, this for me has taken on average 10 to 30 minutes per patient, I'd say. So for 4 patients, charting and writing notes for the shift can take anywhere from about 40 minutes to 2 hours of my day. So it is good to plan multiple times throughout your shift to dedicate just to charting and writing notes, basically sitting at the computer for a while. I'd like to mention too that throughout the entire day shift, in addition to everything I've already mentioned in this video, I'm communicating with doctors that are coming in and out of patients' rooms. They like to speak with me to get any updates on my patients and also to inform me of any updates to the care plans. I'm also receiving calls from family members and updating them. I'm receiving various calls from places like the lab. They'll call if there's a critical lab value that came back, or from tele. If my patient is on remote tele, they'll call if their heart rate's doing anything strange or if their leads fall off. And I'm checking my messenger app on the computer because a lot of providers, care coordinators, discharge planning, other teams use the chat messaging to provide updates or ask questions about patients. So I'm always checking that too. I work 8-hour shifts. So around 3 p.m., the oncoming nurse will arrive and start getting settled in. I want to be ready to give report ideally around 3:15 p.m. Then I give report, which takes about 15 to 20 minutes usually. Ideally, when I'm done with that, I'll leave. But oftentimes, I still haven't finished charting, shocker. Or there might be some tasks that the oncoming nurse asked me to get done before I head out. So I'm definitely not always done at 3:30 p.m., which is the time the shift is technically supposed to go until. But there have been plenty of shifts when I'm not getting out of there until as late as like 5 or 5:30 p.m. Because some days you don't sit down at all. And you literally can't find any time to chart. So you might have to stay late to finish charting. Thankfully, I've had less of those days the more experienced I get. So I'd say on average now I leave around 4 p.m. All right, that completes a day in the life at my job. Please, you guys, ask me any questions you have about anything. This is actually my first ever vlog, so I'm actively learning what I want this channel to be for people. I'm learning how to videotape myself. Feels a little awkward sometimes. But yeah, I want this channel to be for all of us. I would love any recommendations. I want any advice. Don't be afraid to ask questions. Tell me some future videos you'd like to see. I want to be here for you guys and help you through this crazy career choice we made, we are all in this together, and it feels so much better knowing that other people are experiencing this with you. Trust me. Thank you so much for watching. I will see you guys soon. Bye.